Alison, did you want to come along? Just have a sit in there. How do you do it? Would you be kind enough to move your foot up for me? Excellent. And now push hard against me. That's very good. The foot is an extraordinary part of the anatomy and the body. It is important to realize that although the feet are at the end of the body, they are not second class. It's important to look after them. It's important to look for abnormalities or problems. A minor problem, although it may appear to be minor today, it may be a significant problem tomorrow. So take action now, and it's simple. Make sure that you look after your feet properly.
I had an appointment with the podiatry department for a review for a foot problem that I had. It has resolved now and it's made a great difference to me. Often if you have a foot problem that you neglect, it just becomes something more serious, and it can be more difficult to treat or even be untreatable. You could be suffering with pain for a while and that can be avoidable.
There are actually 26 bones in each foot, and there are over 100 ligaments, 19 muscles, and apparently about 7,000 nerve endings. So there's an awful lot of structures in a foot. Probably the most common thing that we see is corns and callus or hard skin. If you have some minor hard skin or dry skin, especially around the heels in the summer when you've been wearing sandals, it's nice to use something like a foot file. These are readily available in a chemist shop or a body care shop, and they're simply a new idea on the pumice stone. For most people, corns and callus are easily removed. So if you have a foot problem such as corn, callus or ingrown toenails, the person to see would be a podiatrist. If you're seeking out a podiatrist, look for one that is registered with the HPC, that's the Health Professions Council. People that have certain medical conditions may require regular podiatry treatment or more in-depth treatment. Your GP would be able to refer you for that treatment at your local NHS clinic.
We also see a lot of patients who have inappropriate footwear and things like that, and as a result, are in a lot of pain and discomfort. It's quite often the footwear, is some of the challenge in making that patient pain-free. If we can get the patient into a good pair of shoes, then we've got a lot more scope for practice as to how we can treat that patient. We do use an in-shoe pressure measuring system. It involves inserting an insole into a patient's shoe, and it will actually show us areas of high pressure and general pressure distribution and the times in which the pressures occur across the foot as that patient's walking. Pictures speak 1,000 words, so using the data that we've captured, we can then show the patient exactly where the areas of high pressure are on their feet. It's a very good tool for demonstrating to patients, how their feet and their footwear interact together.
Be shoe savvy, don't wear high heels and pointed toes unless it's on special occasions. You're not going to wear your carpet slippers to go rock climbing and your Wellington boots for tea with the Queen. So think about what it is you're going to do every day and wear shoes accordingly. If you're going out to buy shoes, there's some really good ways of making sure you get the right thing. Firstly, go shopping midweek if you can, when the staff have more time to attend to your needs. Don't be afraid to ask them to bring out lots of different shoes. That's what their job is and that's what they should be doing for you. Try to shop for shoes in the middle of the afternoon because your feet do swell as the day goes on, so it's best to buy them when the feet are slightly larger.
Your feet, and nobody knows your feet better than yourself, so if there's something wrong with them, and get in touch.
It pays to be foot aware. Your feet will look after you if you look after them, so a little bit of time and effort will go a long way.
We don't realise exactly how much time we spend on our feet. We rely on them to be, from the time we wake up in the morning till evening, we're on them all the time. You're bearing the whole weight of your body all throughout the day, so it is important to look after them.